Sarah, and I work for WIC as a nutrition education consultant. Today we are going to discuss introducing solid foods into your infant's diet. But first, let's review the key points of today's lesson. First, we will discuss feeding cues and signs that your baby is ready for foods. Then we will show you how to introduce baby foods and give you tips on how to alleviate stress surrounding the introduction of baby foods. Lastly, we will explain what to expect on your baby's food package starting at 6 months of age. So feeding your infant is fun, messy, sometimes frustrating, but very important. The first few months, you have been providing your baby breast milk or formula and might be wondering when you can begin introducing complementary foods. Complementary foods are foods that are introduced during infancy to complement human milk and/or infant formula. It is recommended to continue breastfeeding for at least 1 year or longer if desired by the mother and the baby. WIC recommends to wait until 6 months of age, but some pediatricians might tell you it is okay to begin introducing these foods around 4 to 5 months of age. If your baby was premature, speak to your doctor on when you can start introducing these foods. There are a few signs that your baby will begin showing you that they are ready for food. Your baby should be able to sit up alone or with little assistance, have good head and neck control, open his or her mouth to a spoon, bringing objects to their mouth and showing interest in foods that you are eating, and then able to swallow food rather than pushing it back in their mouth with their tongue. Have any of your babies started showing these signs? If so, think or write down what signs your baby has started to show. However, if your baby is not showing these signs, that is totally okay. Most babies will not show signs until closer to 6 months of age. Offer your baby breast milk or formula until he or she shows signs that they are ready for these foods. We want to make sure that each baby is able to sit up on their own and have good head and neck control. For those babies that have started showing signs and are 6 months of age, your baby is ready to start these foods. So let's think about what you have heard in terms of introducing baby foods. We understand that there is a lot of information on this topic and sometimes it can be very overwhelming. There are a few ways to begin the introduction of baby foods, but today we will discuss what WIC and the American Academy of Pediatrics recommends about introducing infant foods. First, introduce one new single food at a time. Allow 3 to 5 days in between the introduction of each new single food ingredient to observe for possible food allergies or reactions. Such possible allergic reactions look like a rash, wheezing, diarrhea, or other intolerances. A single food ingredient will look like sweet potatoes. However, when your baby gets older, you might notice something like this at the store, which has bananas, apples, and pears. You can start offering these foods once the baby is older, but for now, just try the one single ingredient food. Introduce a small amount of each food like infant cereals, meats, fruits, or vegetables. These are called first foods. First foods are pureed, well-mashed foods that can be prepared or pureed at home or pre-made in the store. Iron-fortified cereal and baby meats are great first foods as they are both high in nutrients like iron and zinc. If you would like to introduce fruits before vegetables, that is totally okay. Research has shown that introducing fruits first does not mean your baby will dislike or not like to eat vegetables. In the beginning of introducing foods, you can add a little bit of formula or breast milk into the food so it is a little bit of a familiar taste to your baby. For example, some of our WIC parents have recommended adding breast milk or formula into iron-fortified cereals when introducing first foods. So once you decide what the first food is that your baby will eat, you might be wondering when you can continue offering a variety of foods and how to feed your baby as they grow. Start with one feeding and gradually increase feedings to 2 to 3 times a day. The first few weeks, your baby might only be eating a few ounces of food, like 1 to 2 ounces. For example, this is a 4-ounce jar of baby foods. 2 ounces may look like half the jar, and 1 ounce is a little less than half the jar. As a food safety tip, if using a jar of food to feed your baby, pour a small amount of the baby food into another bowl and refrigerate the remaining amount. Meat, poultry, and eggs can be stored for 24 hours, while fruits and vegetables, like the sweet potatoes, can be stored for 48 hours. Most infants beginning to eat will typically not eat the entire jar in one meal. As your baby grows, they will continue to take in more ounces at each feeding. We will discuss some fullness cues to look for later on in the lesson. Just remember that the quantity of food an infant consumes will change meal to meal and day by day. Continue to offer foods until baby shows signs of fullness. Your baby will tell you he or she is full by turning away from the food, pushing away the spoon, slowing down, or closing his or her mouth to the spoon. As a reminder, your 6-month-old will still be breastfeeding on demand or consuming formula every 3 to 4 hours. The consistency of pureed foods will gradually get thicker as your baby continues to learn and to eat different foods. By 8 to 10 months of age, your baby should be consuming foods from a variety of food groups along with breast milk and formula. This is also the age where babies tend to begin finger foods. Finger foods are the first steps for baby to learn how to feed his or herself. Once your baby can pick up foods with their fingers, you can introduce small, soft pieces of table foods without any added salt or sugar. Great table foods to consider are bananas, avocados, eggs, sweet potatoes, beans, cooked noodles, cooked carrots, and soft peaches. Only a few pieces at a time is necessary. Give more if baby is still acting hungry, but remember those hunger cues. Allow your baby to get messy so they can explore different textures to practice feeding themselves. This is also a great time to start introducing the spoon. In summary, we have discussed when to introduce foods, how much, and how often. Now we will cover what to expect on your baby's food package starting at 6 months of age. For exclusively breastfed infants, you will receive 256 ounces of baby fruits and veggies, 31 jars of baby meats, and 24 ounces of infant cereals. For partially breastfed or fully formula-fed babies, you will receive 128 ounces of baby fruits and veggies and 24 ounces of infant cereals. Now, how do you feel about introducing baby foods? Are you excited or maybe even anxious? Do you have any questions? Let's go over 6 commonly asked questions when introducing baby foods. The first commonly asked question is, what if my baby makes a face when trying new foods? Faces are okay. Your baby is trying flavors for the first time, and it does not mean they do not like it. Continue to offer a variety of foods and flavors, but remember to introduce new foods slowly. The recommendation from the APA is a new single food every 3 to 5 days. The second commonly asked question are, what about adding cereal to the bottle? Cereal in bottles can sometimes be given under a doctor's supervision, but otherwise is not recommended. Cereal can lead to choking and extra weight gain for your baby. Also, adding cereal to the bottle will not help your baby sleep. This is a household myth. The third commonly asked question is, what have you heard about food allergies? It was once believed that delaying the introduction of allergy-causing foods reduced allergies, but research has shown that introducing allergy-causing foods early and often actually reduce the risk of allergies in children. Allergy-causing foods like eggs, dairy, soy, peanuts, or fish can be given to your baby when they begin eating at 6 months. Continue to follow the 3 to 5 day rule after introducing a new food. Talk to your doctor if you have a family history of allergies. Within a few months of starting solid foods, your baby's daily diet should include breast milk or formula, meats, cereal, fruits, vegetables, and fish. The fourth commonly asked question are there any foods to avoid feeding my baby? Avoid cow's milk and honey until the age of 1. Also avoid hard, crunchy foods like raw vegetables and raw fruits, chips, popcorn, candies, and nuts. Also avoid large pieces of food like meats, blueberries, and grapes. To prevent choking, make sure anything you give your baby is soft, easy to swallow, and cut into small pieces. Some examples include small pieces of bananas, wafer-like cookies, crackers, scrambled eggs, well-cooked pasta, well-cooked meats and chicken, and well-cooked cut-up potatoes or peas. The fifth commonly asked question is, when can I start introducing a sippy cup? You can begin offering a sippy cup at 6 months of age. Offer 1 to 2 ounces of water during or after meals. You can offer 3 to 4 ounces a day once the baby is 9 months old. The sixth and last commonly asked question is, should I give my baby juice? WIC recommends to avoid offering juice until the baby is at least 12 months old. After 12 months of age, give only 100% fruit juice and no more than 4 to 8 ounces a day. Offer it only in a cup, not a bottle. Today we learned about baby cues and introducing solid foods. What are you most or least excited to try with your baby? Take the time to write down the answer to this question or a goal you have for introducing solid foods. Thank you for taking the time today to watch or attend this infant feeding class. Please contact your local WIC office with questions and to schedule your next WIC appointment.